This episode contains discussions of the serious topic of suicide. If you or someone you know needs help, please dial 988. Now enjoy Bronco Tales.
Hi everyone, my name is Kenzie Sorrells and I work as the Director of BroncoFit, which is the Wellness Services section of Health Services over here in the Norco building. Today joining me is Michelle Tassinari and Anita Suljic. Michelle Tassinari is a licensed professional counselor from Boise, Idaho. Michelle currently works in a non-clinical case manager role doing suicide prevention, post-hospitalization support, skills training, and is the project manager for Boise State's JED Campus project. Anita is a graduate assistant serving in BroncoFit, overseeing the peer health educators and their role in prevention work here on campus. Today we're going to be talking about suicide prevention and all the things around suicide prevention at Boise State. This is the Bronco Tales podcast with the College of Health Sciences, and here we go. So today's guiding question is, what is suicide prevention and what does that look like on Boise State's campus? And I'd love to hear from both you, Michelle, and Anita.
Yeah, so the way Boise State approaches suicide prevention is really creating connection and belonging on campus. We have really tried to shift the mindset that we need to do some kind of big sweeping intervention that comes at the last minute when someone is already kind of experiencing suicidal thoughts or already in a mental health crisis. And we're trying to walk upstream before somebody has entered that crisis. And maybe they don't even know that something's happening, but as Boise State, we are a community that comes together and creates connection and helps people feel like they have a place in the world. So that's kind of our campus approach. Mm-hmm. And we have a variety of interventions from prevention work like that all the way through postvention for a variety of different situations involving suicidality and mental health crisis.
Yeah, I would love to talk a little bit more about what does upstream work look like? What does that mean? Anita, if you want to pop in here, feel free from a student perspective if you see things across campus. Yeah.
I feel like the upstream approach is looking to make efforts before the situation worsens or students are in desperate need of help immediately. And I feel like as a student, I appreciate the efforts that DINA students, BroncoFit, counseling, and other departments here on campus, starting those conversations early with Suicide Prevention Week and just in general with mental well-being, and letting students know what is available here and letting them have that opportunity to get support before it gets bad.
Thank you.
I was just in a training yesterday with some housing folks, and we talked about upstream prevention in kind of a floating the Boise River metaphor. And so we talked about, like, you're getting in at the park, at Barber Park, and you've got your stuff, and you kind of notice some people are floating with air mattresses and maybe don't have paddles. Other people are, like, super equipped, maybe with a helmet and, like, all the kinds of equipment that they need. And taking note of that is kind of like prevention, recognizing folks that might not be fully equipped to handle situations that may happen down the river. And sometimes that means there's a lifeguard standing on the edge, maybe watching for folks that are hitting small rapids, or maybe their tube pops and they need somebody to watch out for them because the rapids are about to come and their tube is popped and they need help.
Yeah.
And that's the metaphor that our office really has leaned into, is if we can help people in the Boise State community have eyes out for folks and be watching for the people that need help before the rapids come, it makes everyone's life a little bit easier and can really be an impactful difference and the determining factor between somebody staying at Boise State and successfully graduating versus somebody having a really difficult time and maybe feeling like they're not cut out for college when it's really just circumstances or cards that they've been dealt.
Yeah, absolutely. And I'd like to plug JED here. Michelle and I work on a committee together that focuses on mental health for students. And Michelle, if you're willing to, would love for you to expand on JED. What are the things that are involved in JED? What are we doing as a university to really make this possible?
Yeah, Kenzie's such a good advocate for JED. I appreciate it.
You're welcome.
So JED Campus is a 4-year partnership with the JED Foundation, and the JED Foundation is a nonprofit formed after an individual named Jed died by suicide in the early 2000s. And the goal really is to equip colleges and K-12 settings with prevention tools and really this upstream prevention approach in a way that is structured within the university. So it's not just a singular awareness week, but it's policies, it's syllabus statements, it's approaches to onboarding for new faculty and staff to help everyone understand that mental health is important and kind of create a culture of care and a thriving community ultimately. So that's where the JED campus fits into Boise State. It's a goal within the thriving community goal in our blueprint for success, our strategic plan. And we are in, what are we in? We're in year 2 now. Yeah, so we're about halfway. And we're implementing some really great interventions to try and support Boise State students. A part of our partnership with the JED campus program has been them coming into campus and evaluating what we currently have, which is, such a vulnerable place to be, because you have to say, here's the parts that we don't love about our campus, right? And here's some really important areas of growth, even if we don't always want to hear them, myself included, right? It's important to objectively listen to that. And we got some good feedback of things that we can actually take steps on. And your office is a part of that, ours, but faculty are a really huge stakeholder in that too. So as we kind of work to develop this out, hopefully our goal is to create a little bit more understanding and awareness of everyone's role within prevention work, even if it's in the classroom and you're teaching physics, right? What is your role within suicide prevention and mental health support? And then ultimately help students understand that we care about them and we want to help them.
Yeah, no, absolutely. Thank you for sharing that. And I would also like to point out that Michelle's done a really great job bringing in a student perspective too. We know as, faculty and staff, we don't always know what students really need and want. And so having that student advisory board has been really, really helpful in pushing these forward as well. I really want to touch on Suicide Prevention Week. Yeah. I feel like, it's been around for a few years now. I would love to hear kind of where that started. Anita, I would love your perspective on, getting involved in events. I'll throw it back to you, Michelle.
Yeah. So Suicide Prevention Week was kind of my brainchild in 2021. I actually started my position here on campus during the pandemic. So that first year, I was all remote and seeing so many students in crisis and really having difficult circumstances happening to them, but then also them not being helpless and not quite knowing what to do. And a lot of people on our campus were in pain. So as we started to transition back, I was like, what can I do about this? How can we make this as big and as out there as possible? And so I was like, let's do Prevention Week. I do not have a background in prevention at all. I am a counselor, which means I'm a little bit introverted and more of a people person rather than an event broad scale person. So it was a stretch for me personally, but it was an important development opportunity for the institution and for those of us doing prevention work to lean into this. It was not as well attended as I wanted, right? It's the first year of anything. So,
always, yes.
Yeah, so it wasn't anything wonderful, but it was a starting point and a really important catalyst for some change on campus. So we have evolved since last year. We brought in BroncoFit, and your partnership has just been so important to me as a professional, but also our offices collaborating. I think we're a tough dynamic to go against between Absolutely. The two of us. Yeah. So we're able to bring together a lot of institutional knowledge and gather some really important stakeholders. So this coming year, we've got a fabulous menu of events available for people. I would love to hear, as a student, kind of how have you conceptualized the evolution of prevention work for suicide on campus?
I feel like it's evolved a lot just in my second half of being at the university. I was a sophomore when COVID hit, so I feel like I don't have much memory of how it happened my freshman and sophomore year. But I do remember I have memories from last year and the year prior of Suicide Prevention Week and stopping at booths like the flower stand from last year and just knowing where to look for those resources to find what is happening here on campus. So it's been really cool to see the growth, and I know other students who I'm friends with also remember a lot of those events, especially from last year. So it's been cool to see that it's already catching on and students know that it's going to be happening year to year and can look out for it moving forward.
Oh, I appreciate you saying that, because I feel like sometimes we change things up so frequently we don't create tradition. And tradition can be such an important part of establishing connection and community, because you have that mutual buy-in inherently with the folks that you're sharing an identity with. And so I'm hoping to create some tradition with this. And who knows, maybe Mental Health Awareness Week in October also, and Eating Disorder Awareness Week. There's a lot of opportunity for us to just expand this prevention work and build in that tradition to create that community on campus. So I'm excited about the possibilities.
Absolutely. And I think it's important to point out that, a lot of our programs maybe are geared towards students, but the more buy-in faculty and staff can provide, the higher attendance, the more we together as a university create that culture of care, which we're striving for. So when is Suicide Prevention Week? When's it happening?
Gosh.
What are the details? Do tell.
What a great question, Kenzie. So Suicide Prevention Week actually falls on September 11th through the 15th this year. Out of respect for 9/11, we are taking that day to just offer some community care events. And I say events loosely, more of just like some passive community builders. We're going to have donuts around campus, because you do not know how much you matter. So
I love it.
Opportunities to just have some fun, and also acknowledge a lot of sacrifice, a lot of pain, and a lot of loved ones that are not with us during that time. So honoring that. And then September 12th, the next day, we will have our big kickoff headliner event, the Here For You Fest. And that event is really spearheaded by BroncoFit. Your team has done wonderfully planning that, and it's going to be something to come see.
Yeah, I feel like it's going to be pretty huge. There's going to be bounce houses, hopefully a temporary tattoo artist, food, shirts, tote bags, and lots of different activities like tie-dyeing. We'll have our lovely dogs there, so you can come pet a dog, but also chit-chat with some counselors. And just a variety of different activities for you to get involved with the university, but also understand, what resources are here for you for mental health. With that, we would also love to extend the invite to faculty and staff just to stop by and also learn about the resources that you can provide students.
Yeah.
Because again, your support is so valued. So, and then after that, what's next?
Then we will have the flower truck. We're calling it Mental Health in Bloom this year. Yeah. So
I'm looking forward to it.
Tell your friends, Anita. Yeah. This was like one of our more popular events last year. And it's the cutest little 1950s truck that's been renovated and so beautifully done. And the bed of the truck will be filled with flowers. So Posey Blue, shout out to Posey Blue. They're a wonderful group that is so supportive of our mission, and we'll be parking on campus. We're going to have the flower truck open for folks to come take a flower to a stranger, hopefully as a random act of kindness. But also maybe your heart needs a flower that day too. Maybe you have worked hard, or you're really homesick and you just want something happy to look at in your new residence hall room.
Absolutely. I know I would need a flower.
Right?
Yeah.
I know. So it's pretty cool. We're going to have some music out there too. Lots of stickers that are like mental health, floral kind of vibes. And then the next day we're going to have a Puppies and Popsicles event.
Love.
Who doesn't love puppies? And on a hot day, who doesn't love a popsicle?
Absolutely.
Right?
Yes,
Yeah.
so needed.
So our friends in Bronco Bold, the athletic student organization for student mental health, is partnering with us to have 2 therapy dogs, at least, probably some more, available for some snuggles and a popsicle and just a nice little interaction, hopefully to brighten your mood between classes. And yeah, also faculty and staff we would love to see out there. I think one of the most impactful things I heard from last year was a student was talking about how cool it was to see faculty in blazers or the higher ups stopping at these stations and being engaged in the community activities, because they see faculty and staff on campus as these untouchable kind of superheroes.
Absolutely.
Right? It's like the parent effect. When you're little, you think they're superheroes, they don't do anything wrong, and so having them humanized a little bit is a really cool way to do some relationship building, and also just gains a lot of trust in our students' eyes, which is when we can be the most helpful for them. So we invite everyone out to come see it. That night too, is that the night we're doing Chalk the Walk, or is it the next day?
I think it's the next day.
Yeah.
Friday.
Yeah, the Friday. We are prepping the walkway for our suicide prevention football game by having a bunch of suicide prevention messages, chalk art drawings on the ground, so that everyone can kind of see inspiring messages, or maybe as an artist you're out there and you feel called to do some art around mental health and mental health awareness. We'd love to have you out there and feature your art on our social media. So come join us for that. That'll be fun. Last year we did pizza and some cold drinks and just had music going while folks did chalk art, which was pretty cool. And then the next day is our morning football game.
So excited.
So cool.
It's gonna be so much fun. Yeah.
Yeah. So it's our official Suicide Prevention Week game for the season. And we will have special shirts out for students. And there's going to be a shirt giveaway. Yeah. I don't know if they do it in that big hot dog launcher.
I really hope so.
I hope so too. Because it's kind of, I think it's called the Frankenflinger.
Oh my gosh, of course.
Yeah.
Yeah.
Flinging Here For You shirts. So it's very cool. We'll have a halftime or a timeout type break talking about suicide prevention. There's going to be turquoise colors all around campus that week, so keep an eye out for wherever you see turquoise colors on campus during the day or night. And you might just think of our suicide prevention efforts and maybe how you can be a part of suicide prevention either in your life outside of Boise State or within the Boise State community.
Yeah, I love that. I really want to highlight our tagline too, the Here For You.
Yeah.
It's always just a good reminder that, we're all people and we're all need to be here for each other. Yep. And Boise State in all aspects is here for you,
yep,
as students, as faculty and staff, to support you through all things. So
yeah. And that brings up a good point too. Like as faculty and staff on campus, we do want you to, we're asking folks to pay attention to students, but a lot of these resources are also applicable to faculty and staff.
Absolutely.
So if you see a colleague that's, struggling, or if you yourself are struggling, we're going to have resources all week. HR has resources. We have wonderful EAP support. And especially at the Here For You Fest, we'll have vendors and mental health resources from the community.
Yeah.
It's not just Boise State stuff.
Yeah.
So that's what I appreciate about how we've evolved Suicide Prevention Week, is we're trying to bring in a lot of other stuff. It's not just Boise State resources.
Yeah. We care about everyone.
We do.
Not just
we're
us,
here for you.
So. Hey.
Yeah.
All right. To kind of wrap up our conversation today, I'm going to ask you like a little wrap-up question, both of you.
Okay.
What is one big key takeaway you want folks to walk away knowing about suicide prevention?
That's a good question. I think I would like folks to know that suicide is preventable, and you don't have to be a counselor to be a part of the prevention.
Snaps.
Right?
Yeah.
Sometimes suicide prevention is when you see someone crying, asking how they are, or saying thank you and making some eye contact with the barista at Starbucks when it's a busy time of day.
Yeah.
Suicide prevention can be minimal things that really shift someone's day. And in fact, a lot of the research is showing us that it's those little things that tend to be protective factors against suicide and outweigh the risk factors that can often be really insurmountable for somebody. So it's achievable, it's accessible, even if you don't feel like you know anything about mental health. I'm sure you know how to put a smile on someone's face, and that's suicide prevention.
Love that.
Yeah.
Love that. Anita, what are your thoughts as a student?
As a student, I know being a student is hard and it's overwhelming, and I would hope that from Suicide Prevention Week that students can understand that what they're feeling is valid, and that they can to never minimize what they're feeling and feel that they're not worthy of receiving support, but also knowing what support is around, so that if they ever need it or their friend needs it, they know where they're able to go.
Yes.
Well
so
said.
important.
Yeah.
So important.
Yes.
Well, hey, I appreciate both of you being here so much and helping us spread the word about suicide prevention here at Boise State. We appreciate both of you, and as always, we're here for you.
Thanks for having us. We'll see you
Thank
all
you.
at our events this coming
Oh,
fall.
yes, I hope
Yeah.
so.
This has been Bronco Tales with the College of Health Sciences. If you enjoyed this episode, don't forget to rate and review us on your favorite podcast platform. Next month's episode, we'll dive into the School of Social Work as we learn about our new divisional dean, David Becerra. We'll see you there. Now enjoy this preview.
One of the things that interests me about your story is really how you saw firsthand what a system experience was, and then you wanted to be involved in potentially changing it.
I think because of that, this shaped me to think about like bigger macro issues in ways that I think many, especially social workers, may not be thinking about that.